Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality, to please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's briefing are Governor Tony Evers, DHS Deputy Secretary Julie Willems Van Dyke, and available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer with the DHS Bureau of Communicable Diseases, and Ryan Nilsestun, Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thank you for joining us this afternoon. Today, I'm excited to announce that we're expanding and increasing our testing capacity in Wisconsin. The story of testing capacity in our state is an impressive one. We went from having no capacity in early March to now in August exceeding our current goal with a capacity of nearly 150,000 tests per week. So I want to thank our incredible public and private partners in Wisconsin, partners like Exact Sciences and Marshfield Clinic, and our new partner, Accelerated in Milwaukee. Thanks for all of your good work in helping making sure that we have the lab capacity to continue our testing efforts across the state. Additionally, as you know, on Saturday, Wisconsin's statewide face covering requirement went into effect. Folks, I want to thank you for doing your part to flattening the curve to prevent the further spread of this virus and to help keep our friends, family, and neighbors safe. And I'm not the only one who appreciates your efforts and wants you to wear a mask. Katie from Green Bay, who is a mother of two and wrote to me and said she cares for her 80-year-old grandparents. She's worried every day for their safety. She appreciates your efforts. There's Bria, a college student from Kenosha who is worried and anxious to go back to school. And Abby from Milwaukee who emailed to say she works with small businesses and wants to see them safely stay open. Or the countless healthcare providers like frontline nurses Kathleen and Olivia and Thomas, who is a physician from Wausau, who all wrote about the importance of masks. They all appreciate your efforts to wear a mask and keep their communities safe. And there are countless businesses across our state who want to keep their workers and their customers safe, and they want you to mask up too. Because as I've said many times before, public health is a team sport. We need everyone to take this seriously because it's on all of us together to ensure our public health efforts are successful, our businesses can stay open, and our state can bounce back together. We were in a pretty good place a few months ago, but we've hit some serious setbacks, folks. And we will continue to have setbacks until we decide we're all in this together. So please remember to wear a mask whenever you are indoors or in an enclosed space other than a private home. Anytime another person who is not a member of your household is present in the same room or enclosed space, and anytime you're outside and unable to safely maintain 6 feet of distance from others. And I want to be clear, masks are not a substitute for physical distancing. As Secretary-designate Palm explained last week, with community spread statewide, you should assume anytime you're out in the community, you could have had contact with this virus. So above all, the safest thing to do is stay home and avoid gatherings of friends and families. That means bars, backyard barbecues, and family get-together, folks. It's just not worth it. More than 55,000 Wisconsinites have tested positive for COVID-19, and some are fighting for their lives as we sit here today. We've had 949 deaths in the state, and that means families have had to say goodbye to loved ones, to mothers, fathers, grandparents, siblings, and friends, to community members, and familiar faces. It's not worth it. If you do come into contact with folks outside your household or start experiencing even minor symptoms of COVID-19, get tested. Call your healthcare provider or find a local community testing site and isolate yourself from others until you get results. I know it's tough. I know Wisconsinites from Superior to Beloit are making some huge, huge sacrifices. But I can tell you, folks, every time you stay home or you wear a mask, you could be saving a life. That's worth it. We need to work together to get Wisconsin back on track to beating this virus so that we can get back to the activities we all enjoy and miss, and so our economy, communities, and our state can recover. Now, I would like to turn it over to DHS Deputy Secretary Julie Willems-Van Dyke for her update. Julie?
Thanks, Governor. Good afternoon, and thank you for taking the time, Governor Evers, for recognizing the great work our Wisconsin labs are doing. Like Governor Evers said, lab capacity in Wisconsin has grown from 0 to over 24,000 tests per day since March. It's an impressive number, but what is even more significant is what that lab capacity has allowed us to do in our response to COVID-19. Because we have continually expanded our lab capacity in Wisconsin, we have been able to test and retest our healthcare workers in hospitals and skilled nursing facilities who are on the front line of this pandemic. We have been able to respond quickly to outbreaks and offer testing to entire facilities and businesses. We have been able to expand our testing criteria from only testing the sickest people to testing people with mild symptoms and those who have been in close contact with someone who has COVID-19. And thanks to our expanded lab capacity and our partnership with the Wisconsin National Guard, we have been able to stand up community testing sites across our entire state. And every time we expand the state's access to tests, like we are announcing today, it means strengthening our response as well. One of our greatest areas of need for a strong response is protecting our skilled nursing facilities. We must protect this vulnerable population from COVID-19 because they are at such a high risk for severe illness or death. And that is why we are prioritizing these newly acquired tests for nursing homes with the goal of regularly repeating testing for all employees of skilled nursing facilities, along with symptomatic residents. This is the kind of response that saves lives. It is the kind of response that increased testing makes possible, and it is the response Wisconsin is committed to as we work towards this goal. As of today, we have 83 active labs running COVID-19 tests in Wisconsin. We also have 928,845 people who have had negative tests, an increase of 17,410 since yesterday. There are now 56,056 confirmed cases of COVID-19, an increase of 728 people since yesterday. And we mourn the loss of 961 people who have left us, an increase of 12 of our fellow neighbors and friends since yesterday. Thank you again to our public and private partners who make this response possible. And thank you to the residents of Wisconsin. Keep staying home when possible, limiting your trips to the essentials, practicing physical distancing, and wearing a face covering. Remember, I wear a mask for you, and you wear one for me. And together, we can stop the spread.
You will now take your questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And in the interest of time, please only one question per reporter per outlet. And we'll begin this afternoon with Rob Sussman from WTAQ Radio. Rob? And again, Rob Sussman from WTAQ. Okay, we'll try to come back to him. Moving on to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thanks for doing this. My understanding is that President Donald Trump approved the extended deployment of the National Guard through the end of the year with reduced federal funding last night. Can you talk about what impact that cut in federal funding will have, and are additional state dollars going to be needed to support that testing operation? Thank you.
Yeah, and I think I heard your question. Yes, we will have to expand some state dollars for that, some federal CARES dollars for that. I think approximately $4 million. That was a disappointment because that's approximately what we would pay if we use the state authority. So we're happy to have the opportunity to have the National Guard be part of our program. We couldn't be anywhere near where we are today. You heard Julie talk about the success we have had in testing, and a lot of it has to do with our good friends and neighbors from the National Guard.
Thank you, Sean. Now to Bill Glauber from the Milwaukee Journal. Sounds like Rob Sussman has joined us. Rob?
Yes.
Go ahead.
Sorry about that. Yes, I was having issues with Zoom. I wanted to ask a question to Governor Evers here, Rob Sussman from WTAQ. And this is something that Sheriff Todd Delane here in Brown County had mentioned over the weekend in regards to the mask mandate. It seems that a number of sheriffs in the area are not clear or unwilling to meaningfully enforce the face covering mandate. And in fact, Sheriff Delane had mentioned that it is not clear who the governor has designated to be responsible for the primary enforcement of the face covering mandate. We have Green Bay Police saying that they're putting it on a very, very low priority. So to that end, I would ask, who is supposed to be the primary enforcement for this face covering mandate?
Sure. This is Ryan Elsisto, and I can answer that question. So Section 323.2A of the Wisconsin statutes, authorizes a forfeiture for failure to comply, and referrals are made to district attorneys. So that could be local law enforcement, that could also be public health officials, it could be other people who make those referrals. We've worked closely with the Department of Justice in order to provide guidance and information to district attorneys across the state on how this process can work. And I'll just say this in terms of, the comment about compliance and enforcement is, we've seen there's strong broad support for face coverings across the state. We've heard that from people across Wisconsin. We've heard it from constituents. We've heard it from business leaders. So I think while there are some sheriffs or other people who like to make a lot of noise about, either enforcing it or not enforcing it, the fact is I think most people get it. They understand that wearing a face covering is a very small action that can have collectively, we can have a really big impact on combating this disease.
Thank you, Rob. Now to Bill Glauber from the Milwaukee Journal Sentinel. Bill? Milwaukee Journal Sentinel? Okay, we'll move on then to Rachel from TMJ4 in Milwaukee. Rachel?
Hello there. Are hospitalization rates numbers correct now? Last week, Secretary Designee Palm mentioned there was some new input and data requirements that were slowing the reporting. So just checking to see if state hospitalization rates are correct now. Thank you.
We are continuing to link the data sets that Secretary Palm referenced last week. So they are not yet completely accurate. We're getting closer in that regard, and we are seeing more hospitals reporting, and very soon we hope that we'll have the two different systems fully integrated so the complete picture will be there. But as Secretary Designee Palm said last week, this was a sudden change by the federal government and required us to integrate two different data systems under very short order. That work is underway. We really appreciate the partnership of our friends at the Wisconsin Hospital Association and all of our hospitals across the state who are gathering data every day so that we can fully understand this, and we'll be able to have that data very soon.
Thank you, Rachel. Now to Jason Kelby from Fox 6 in Milwaukee. Jason?
Good afternoon, Governor Evers. In light of the new report from the CDC regarding the elections here in Milwaukee, you said you will always follow the science. Now that the science says there was no clear increase in hospitalizations or deaths after the election in Milwaukee, are you rethinking that initial move to postpone the election?
To postpone which election?
That was the April 7th election. The new report from the CDC outlines that there was no increase in hospitalization cases or deaths.
We're going back in time.
After that
Sorry.
election.
I didn't realize we were doing a retrospective here. No, that doesn't change my mind. At that point in time, we had, as I recall, just a handful of places to vote in the city of Milwaukee. Seemingly, now my memory may have failed me here, but seemingly at least 100 voting places less, which regardless if it snowed, rained, or had or did not have COVID-19, wasn't enough. We had people standing in line for 4 hours in many places. So the concern people had about their own health maybe did not end up with any COVID-19 being transmitted, at least by the CDC's estimate. But under no circumstances were we ready for an election when we had people not being, or municipalities not being able to find enough poll workers to do an election well. That's why we ended up with 1.2 million people doing mail-in voting, and we're hopeful that that process continues going forward in the upcoming election in November.
Thank you, Jason. Now to Nick Williams from Milwaukee Business Journal. Nick?
Hi, question for Governor Evers. You were quoted in the Milwaukee Journal-Sentinel saying that Johnson Controls, Kohler, Manpower, Quick Trip were some of the, I guess, companies you talked with about the mask mandate and why they wanted it. Can you just give a little bit more details about why they wanted it and any other associations or businesses that talked to you about it?
Well,
thank you.
This was done in a couple different conversations, and just basically their support was around. They thought it was the right thing to do. All of them in their own world have taken precautions for their own workers, and so that's how the conversation went.
Thank you, Nick. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call today. I wanted to just jump back to what you had mentioned earlier regarding testing. It was my understanding that the DHS website has had a capacity of 24,000 since, I think, mid-July. I just was wondering if you might be able to clarify a little bit about kind of the increased capacity you had mentioned earlier. Thank you.
So what we have done is secured additional testing through state supplied and assured that that testing capacity will be available for the state of Wisconsin through our purchasing power. One of the things that we are very concerned about as we see this disease escalate across the nation, and we see long lines of people across different states waiting for testing, is that other states will want to come and purchase testing that is being created by our Wisconsin labs here. And so a big part of this effort has been how can we work with labs within Wisconsin to purchase that testing capacity to assure that it stays here in Wisconsin for Wisconsin residents.
Thank you, Mitchell. Now to either Emily Fannin or Danny Maxwell from WKOW in Madison.
Hi, thanks for the call. This is Emily. Governor, you've said you have no plans to mandate virtual learning, but what is your threshold, or what are you gauging to see whether or not you would close schools again? I also would like to ask DHS the same question.
Well, I'll answer the question. And the gauge that I'm using right now, I'm spending a lot of time talking to people in school districts all across the state of Wisconsin, not just Madison and Milwaukee and Racine and Kenosha. And I am extraordinarily pleased with the conversations that school districts across the state are having. not only with their teachers and faculty members, but making sure that the community is involved, and actually many school districts are involving students in the decision-making. So I think the process is going well, and so I'm looking forward to having further conversations and seeing how things go going forward. Clearly, the virus is not in a position right now to say exactly what it's going to be like September 1st. But indeed, if people want to have a successful school year and beginning of a school year, wearing a mask, having physically distant from each other, and also not going into places where you have a whole bunch of people without masks on in a small place. It's all problem areas. So let's get together, be good about this issue, and have a good school year.
Thank you, Emily. Now to Brittany Schmidt from WBAY-TV in Green Bay. Brittany?
Hi, this is Brittany. I was hoping to ask the governor, the moratoriums are ending kind of across the nation, including here in Wisconsin. So many renters, we've gotten concerns from people saying, hey, I'm in the process of being evicted. Is there anything that the government can do, or what is the advice to people who are facing possibly homelessness?
Yeah, that's a great question, and it's a real concern of ours, especially if the federal government walks back on some of their commitments they've made on unemployment insurance. We are concerned about that. That's why we set aside $25 million for rental assistance so that people won't get in the position of abatement. We're continuing to work with folks all across the state in various ways to make sure that people understand that they have this opportunity to get rental assistance so that they can avoid eviction. But at the end of the day, we may need to do more about this. This is something that's very disconcerting, and we are looking at all options. But we will continue to take care, or to make sure that the money gets out the door around this $25 million rental assistance program.
Thank you, Brittany. Now to John Doran from WLUK-TV in Green Bay. John?
Hi, my question is for the governor. Scott Fitzgerald said yesterday he wants the legislature to convene as early as this week to potentially strike down the mask mandate. If this takes the same route as the Safer at Home order did to the Supreme Court, could you see a different outcome? Does this have maybe a better standing than Safer at Home?
That was a two-edged question, I guess. Yes, I've seen what Senator Fitzgerald has suggested. I think that would be a significant mistake. We all know that wearing a mask is an important way to mitigate against the spread and transmission of this virus. We have lots of things we want to do in this state, making sure our kids have good education, make sure that our businesses are strong, making sure that we can have an economic recovery, and one of the ways to do that is to wear a mask, and that's why we did this order. So we, I would say that doing away with this order would set us back, and we can't afford a setback at this time.
Thank you, John. Now to Jessica Van Egren from Up North News. Jessica.
Hello, thanks for taking my call. I just had a quick question going back to the concerns by some that learning will be, a mandate for virtual learning will be passed. Does anyone know right now what percentage of school districts have already decided to go the virtual route at the start of the school year?
I'll try to answer that in real general terms. I don't think anybody has that number, but I have been spending a lot of time talking to people and looking at the school districts' websites, and just about every school offers a remote option. Just about every school. Most schools have a wide variety of different things, and I would say, just my observation, that a handful of larger districts are going virtual only. But the vast majority of the school districts in the state are not large, and they're looking at all sorts of different options.
Thank you, Jessica. Now to Stephanie Hoff from WIS Politics. Stephanie?
Good afternoon. Thank you for taking my call. My question is kind of bouncing off of the school question. So Senator Fitzgerald said that Governor Evers has flip-flopped on the stay-at-home order and trying to move the April election. So Republicans are fearful that you'll also cave to pressure to ban in-person instruction in schools. And he said Republicans plan to keep pressuring you on the issue. Governor, what is your response to that?
I have no secret plan, as he suggested. As I just said, I've spent a lot of time talking with school folks. I know a lot of them, spending most of my life in it, and I've been very proud of the work that all districts are doing to determine what's best for their students.
Thank you, Stephanie. Now to Todd Richmond from the Associated Press. Todd? Todd Richmond? Okay, let's move on then to Michelle Bake from NBC 15 in Madison. Michelle?
Hi, this question's for Governor Evers. Do you see a political divide all across Wisconsin, not just among lawmakers, when it comes to complying and supporting the mask mandate, and why do you think that is?
Well, first of all, I believe there is a divide, but that divide is not a 50-50 divide. The majority of the people of Wisconsin obey the law without the threat of everyday enforcement. I mean, most people drive the speed limit. Most people don't drive on the left-hand side of the road. Most people don't walk into a restaurant and light up a cigarette. And so I think for the most part, regardless of some sheriffs deciding not to enforce it, most people are complying, because most people comply with all the laws and expectations of the state of Wisconsin. This one especially is important because people's lives and their health are at risk here. Now, why this exists, I would say that a good share of it has to do with the fact that we've had a leader in Washington, D.C. who has, I'll use Senator Fitzgerald's comment, flip-flopped on this issue, and as a result of that, there is some disconcerting differences of opinion. From the science world, people are uniformly supportive of wearing a mask to mitigate transmission of this disease.
Thank you, Michelle. Now to Taryn Powell from Milwaukee Public Radio. Taryn? Milwaukee Public Radio. We'll move on then to Amy Reed from WISC TV in Madison. Amy?
Hi, Governor. Lawmakers are questioning if you'll change your position on schools. They're implying that you have a secret plan to make schools virtual this fall. What do you think voters should, and just people in general in Wisconsin, what should they take out of this between lawmakers and you and handling the coronavirus and all the fallout of that?
Well, the good thing about schools in Wisconsin, they are supported by the people that pay the taxes there and also send their children to these schools. So if I was somebody in Oakfield, Wisconsin, frankly, I wouldn't pay attention to the conversation between Fitzgerald and myself. I'd be paying attention to what the school board and teachers are talking about when they're talking about how school is going to look differently this fall. And that's exactly, surprise, surprise, that's exactly what's happened. So we can have all this kind of back and forth at the state level. It makes good media, blah, blah, blah. But at the end of the day, what's happening in the state of Wisconsin is the vast majority of school districts and are involving their parents, their kids, their teachers, their grandparents, their taxpayers, in determining what the best route is for them. They're also, frankly, using local public health officers to help them make that decision. So that kind of conversation is going on I don't think anybody's out there kind of hanging on for dear life to determine what Scott Fitzgerald is going to say next about this. I think they're actually doing things in the local level, and I've been very appreciative of those efforts.
Thank you, Amy. Now to Kent Wayne Scott from WISN in Milwaukee. Kent?
Hi, Governor. Thanks for taking my question. I just want to follow up real quickly. Much of the criticism about your mask mandate early on involved people saying, look, this should be a decision made at the local level. You chose to do it on a statewide basis, yet with schools, you say the local approach is working. Can you talk about why you?
Sure, absolutely. The virus is every place in the state of Wisconsin. We have schools in every place in the state of Wisconsin. The difference is this, is that all school districts look different. A lot of schools are small school districts in the state of Wisconsin where they already have small class sizes, where they already have the opportunity to keep kids so physically distant. That isn't the case in every school district. And so it's really important there's a distinction between the two. The virus is every place in the state of Wisconsin. It's taking a toll every place in the state of Wisconsin. School districts have different challenges and opportunities because of their size, the support from local folks, and listening to their constituents and taxpayers. There's a huge difference between the two.
Thank you, Kent. Now to Victor Huckabo from CBS 58 in Milwaukee. Victor?
Hello, good afternoon. Thank you again for taking the call. I want to go back to how the Senate says that they're ready to move into session to strike down the mask mandate. However, the Assembly is still not said what they're going to do yet. I'm wondering, Governor, if your office has received any communication or any discussions with some Assembly GOP members who maybe are reaching out and maybe aren't sure if they want to strike it down, and they're reaching out to you and trying to ask any clarifications or anything like that before they move forward, whether or not they want to meet. So just wondering about that.
Yeah, I've had the opportunity to speak to Republican legislators over the last few weeks around policing efforts and what sort of legislation people are talking about relative to that, but I have not had a Republican Assembly member either call me or vice versa on this issue or talk to me.
Thank you, Victor. Now to Steve Prestegard from the Platteville Journal. Steve.
Thanks for taking my question, which is a follow-up to something last week when, Governor, your legal counsel, I believe, made a statement that you were considering reinstating some provisions of executive orders that had been issued during the two Safer at Home executive orders. And I'm wondering if you decided on anything that you plan on reinstating now that we have now that you've declared a state health emergency again.
Well, since I was the one who apparently said that, I think I'll answer the question. So this is Brian Nelson-Stewart. This is a very different situation than we were at the beginning of the coronavirus, of the COVID-19 pandemic. And so, yes, while there is an ability to issue similar orders going forward, part of the reason why many of those emergency orders were issued the first time was because we were having to create a system in order to respond to COVID-19 in this state. The reason for the second public health emergency, among other reasons, was the drastic rise in cases. And so we're in a very different situation. It's requiring a different set of tools in order to respond. So there may be some of those emergency orders or some provisions that we may implement. That said, there's others that simply aren't necessary. And I'll just give you one example. One of the first emergency orders that the governor issued during the first public health emergency was in order to lift vehicle weight limits because there was a run on grocery stores and on toilet paper in particular. So state limits, weight limits set in state law were waived in order to allow grocery stores to quickly restock their shelves. We're not in that situation right now. So we're going to be taking, and we are looking very closely at what needs to be done. But like I said, we're in a very different situation than we were the first time around.
Thank you, Steve. Now to Ryan Curry from NBC 26. Ryan?
Hi, good afternoon. Is there any sort of efforts, maybe increase testing supplies across the state, especially for students and teachers, as some are going back to school in just about a month or so?
Well, this is all part of why it remains important for us to continue to build our testing resources as we move into the fall and winter months. Right now, we have enough testing in order to be focused on people with symptoms, people who have been close contacts to people with COVID, and people in some of our essential healthcare spaces like hospitals and nursing homes. And so as we move into the fall, we'll continue to have those testing supplies focused on situations where students or teachers may have symptoms or may have had exposure. And we'll be working with school districts to think about what are the best ways to help support getting appropriate testing when those situations arise. And again, part of our work with the National Guard and with our local health departments has been focused on testing when there are outbreaks. And so we anticipate as school begins, if we begin to see outbreaks in given school buildings, that will be a situation we'll work hand in hand with teachers and administration to assess situations, make sure there is appropriate testing, isolation, case finding, the contact tracing we've been talking about, and appropriate quarantine. So those, just like when we have an outbreak in a business or in a long-term care facility, those will be situations we'll work hand in hand with local government to address and to stop the spread and protect people within that building.
Thank you, Ryan. Now to Martin Roccasoli from WORT Radio in Madison. Martin.
No questions as of this time.
Thank you. Now to Rich Kramer from Wisconsin Public Radio. Rich?
Thank you for taking my question. If health departments, district attorneys, and local law enforcement are in charge of enforcing the statewide mask mandate, does it make any difference if a local sheriff says that they won't be enforcing it? You know, what's the harm? And also, how long until will there be any way to measure if this masking mandate has made a difference?
Sure.
The answer to your last question is yes. We'll be able to tell because the number of metrics will be able to show that.
Sure. In terms of your first question, like I said before, I think you answered your own question in terms of, if a particular sheriff says he's not going to enforce it, there are other people who can make referrals in order for it to be addressed. The state law allows referrals to be made to district attorneys. We're working with district attorneys on how to proceed with that. But again, while I think there's a strong focus on finding people or day-to-day enforcement, as the governor has indicated, this is the right thing to do. Their science backs it up. It's the right thing to do to protect your loved ones in order to make sure that schools can reopen. And so, we hope that this is used as an educational opportunity and that people are encouraged to do the right thing and to wear a face covering to help slow the spread. And as we said earlier today, it doesn't necessarily have to come down to enforcement in order to get people to do the right thing. We all drive the speed limit for the most part. even if there isn't a threat of a speeding ticket every single day. So I think, as the governor said, we'll see what happens in terms of impact, but we're hopeful, and we've heard from a lot of folks across the state that they're doing the right thing.
Thank you, Richard. Now to Mason Dowling from WAOW-TV in Wausau. Mason? WAOW-TV. Moving on then to Steve Elbow from the Cap Times. Steve?
Thank you. Thank you much. This question relates to EPIC's decision to bring back its workforce of about 10,000 to its Verona campus by the end of next month. Do you think it's appropriate for a large company like that to compel employees to work in person?
Well, there's a number of large employers, in the state that do have a workforce as large as that. The only thing I can say about that, I just saw the piece just before I walked in the room, is that CEO is bringing in people experts to provide input to her and her staff as to the appropriateness of the plans that they've laid out. And from what she said, I'm not a spokesperson for EPIC here, but just telling you what was on CNNBC is that what she said was that if there's some changes that need to be made in order to make the workplace safe, she's certainly willing to do that.
Thank you, Steve. Now to Denise Lockwood from Racine County Eye. Denise?
Thanks for taking my call. So my question is regarding testing, but specifically on the commercial entities that have been taking weeks to process tests. What conversations are you having with those businesses, if at all, to get those test results possibly quicker? And do you know how much of a backlog there is in the commercial testing land?
Well, a couple of things I would say in response to that question. First of all, one commercial testing company is not the same as the next. And so this is one of the reasons that we feel it's very important for us to secure testing capacity with labs here in Wisconsin. We have been monitoring testing turnaround times very closely. It's really important to the response of the disease. If you can't get a test result for 4, 5, 6, 7 days, it does not allow you to get to the person who is infected, to help them understand the importance of isolating and to find out who their contacts are so you can make contact with them in a timely manner. So testing turnaround times are critically important. In our monitoring and analysis of this, what we're seeing, it is largely the national commercial labs that are having the challenges with testing turnaround times. That is, again, because they are being flooded with tests from across the nation. And so they have much higher volumes because they are accepting tests from everywhere. We're seeing much more acceptable testing turnaround times here in the state of Wisconsin. The grand majority of our tests, of our laboratories, are turning around tests within 1 to 3 days, which is excellent. They all want to be getting quicker and quicker, and they are all really committed to that in our state here, and we are deeply appreciative to them for their efforts.
Thank you, Denise. Now to Marty Glazer from Spectrum News. Marty?
Yeah, so my question is, what do you recommend for small business owners whose employees refuse to wear masks, but the business owners themselves fear of having their unemployment insurance going up if they let them go? Is there any recommendations for them?
So if I understand the question correct, it's if an employee refuses to listen to their employer about wearing a mask, this is normally what happens in The employer-employee relationship is that the employer gets to set the terms of employment. And so if it's a health and safety thing, employers do that all the time. On whether it's in, making sure that you're wearing safety glasses when operating power tools, or making sure that you're sober while at work or driving a company car. And this is very similar to that, where wearing a face mask or wearing a face covering is a very simple, easy step for folks to do to help prevent the spread of a very deadly virus.
Thank you, Marty. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you very much. I noticed that the governor of Maryland, Louisiana, Massachusetts, Michigan, Ohio, and Virginia have joined together in a compact to expand the use of antigen tests for COVID-19. And I'm wondering if Wisconsin is considering joining that group, and why or why not?
Well, maybe it'd be helpful to have Dr. Westergaard explain antigen tests, and so people have an understanding of the difference there.
Sure. So there's antigen tests are the first newcomer to the diagnostic testing arena, in addition to PCR. PCR is the molecular test, which tests for the RNA, the genetic material of the virus. That is what's in wide use. That was the initial one developed by the CDC. An antigen test detects a protein of the virus, not the nucleic acid. It has some advantages that it can be turned around more quickly. It comes at some cost of sensitivity and specificity. So the one antigen test that has emergency use authorization from the FDA is not perfectly accurate. In fact, if there's patients who have symptoms, have a negative test, need to have a confirmatory test. So it's a promising development in that we need a diversity of testing strategies. It's not a perfect test, and it's not available widely at a large scale, but certainly a positive development in a new tool. I'll have to defer whether our policy folks are involved in these other discussions.
So as we look at the future and think about what is the best approach, these are all avenues we are exploring. We are not currently in direct conversations with that compact at this point in time.
Thank you, Eric. Now to freelance journalist Suzanne Vitale. Suzanne? Suzanne Vitale? Okay, and we'll try one more time for Bill Glauber from the Milwaukee Journal Sentinel. Bill?
My question was asked. Thank you very much.
Thank you. And that concludes today's media briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.